6 weird signs that you have liver damage. Some people believe that liver issues only happen from drinking too much alcohol, but that's not accurate. There are different reasons for liver damage and infections. It could be due to how you eat, changes in your lifestyle, having a fatty liver, or other reasons. Most people only find out about liver damage when it's advanced and needs serious treatment or surgery. To prevent that, it's important to be aware of the signs and symptoms of liver damage that can lead to big problems. Let's take a closer look at our first sign: yellowing of the skin and eyes, also known as jaundice. This might sound a bit strange, but it's crucial to pay attention to. You see, our liver works hard to process a substance called bilirubin, which is a yellowish pigment. When the liver is not functioning well, bilirubin can build up in our body, leading to that noticeable yellow tint in the skin and eyes. Now, let me break it down a bit more. Bilirubin is a normal byproduct of the breakdown of old red blood cells. The liver usually processes and excretes it through bile. However, if the liver is damaged, bilirubin can't be processed properly, and it starts accumulating. This buildup is what causes the yellow color. In clinical terms, jaundice can be measured by increased levels of bilirubin in the blood. It's essential to understand that jaundice isn't a condition by itself, but rather a symptom of an underlying liver issue. So, if you notice your skin or eyes turning yellow, it's a sign that something might be going on with your liver, and it's wise to seek medical advice promptly. Early detection can make a significant impact on the treatment and management of liver conditions. Point? No. 2. Unexplained fatigue. Now, let's talk about something we've all experienced at some point: feeling tired. But when it comes to liver damage, the tiredness is on a whole different level, and it's often unexplained. Imagine feeling like you need a nap all the time, no matter how much sleep you get. This fatigue can be a signal that your liver might not be functioning as it should. Here's the science behind it. Our liver stores a type of sugar called glycogen, which our body converts into energy when needed. When the liver is damaged, it can't release glycogen efficiently, leaving us feeling constantly drained. Clinically, this fatigue is often linked to elevated levels of liver enzymes and a decrease in the liver's ability to produce essential proteins. So, if you find yourself struggling with fatigue that doesn't improve with rest, it might be your body's way of telling you to check in on your liver health. Don't ignore this sign, as addressing it early on can be key to maintaining your overall well-being. If you resonate with this feeling, consider consulting with a healthcare professional to get a closer look at what's happening inside your body. Moving on to our third weird sign: itchy skin. We've all experienced the occasional itch, but when it becomes persistent, it might be more than just dry skin. The liver is closely connected to our skin health, and when it's not working properly, it can lead to a buildup of bile salts in the bloodstream. This buildup is what causes the skin to itch. Let's break it down a bit. Bile salts are produced by the liver to help with digestion. But when there's liver damage, these salts can accumulate, making their way to the skin. Clinically, elevated levels of bile salts in the blood can be associated with liver dysfunction. So, if you find yourself scratching more than usual and can't find relief, it's worth investigating whether your liver might be sending out distress signals. Itchy skin can be a subtle but important clue that something might be off internally. Don't hesitate to consult with a healthcare professional to explore the root cause of the itching and address any potential liver issues. Early intervention can make a significant difference in managing these conditions and preventing further complications. If you liked this video, then share this video as much as possible, so that this video can reach the needy people. Now, let's delve into our fourth unusual sign: dark urine. It might seem a bit strange to pay attention to the color of your urine, but it can actually reveal important information about your liver health. Normally, urine is a pale yellow color, but if you notice it becoming darker than usual, it could be a sign that your liver is facing some challenges. Dark urine suggests that there might be an issue with how your liver is handling bilirubin. It's like a little warning sign from your body. While it might not be a cause for panic, it's certainly a signal to pay attention to. If you consistently notice dark urine, it's a good idea to consult with a healthcare professional. They can conduct further assessments to determine the cause and address any potential liver-related issues before they become more serious. Remember, early detection is key to maintaining good health. Let's talk about our fifth peculiar sign: pale or clay-colored stools. While it might not be a topic that comes up in everyday conversation, the color of your stools can provide valuable insights into your liver health. Normally, stools get their brown color from a substance called bilirubin, which is produced by the liver. When the liver is functioning correctly, it processes bilirubin and adds the characteristic color to your stools. However, if there's an issue with the liver, it may not be able to process bilirubin as effectively, resulting in pale or clay-colored stools. In simple terms, pale stools suggest that the normal process of adding color to your bowel movements might be disrupted. It's like a visual clue your body is giving you that something isn't quite right. Clinically, this change in stool color is linked to a decrease in bilirubin levels in the stool, indicating potential liver dysfunction. While it might not be the most comfortable topic, paying attention to changes in stool color can be an early indicator of liver issues. If you notice persistent pale stools, it's advisable to consult with a healthcare professional to get a closer look at your liver function and address any underlying concerns. Early intervention can play a significant role in maintaining your overall health and well-being. Now, let's talk about the sixth peculiar sign: bruising easily. We all get the occasional bruise, but if you find yourself bruising more easily than usual, it could be linked to your liver's health. The liver produces proteins that play a crucial role in blood clotting. When the liver is not working optimally, it may struggle to produce these proteins, leading to a higher likelihood of easy bruising. To simplify, think of it like this. The proteins produced by the liver are like the body's internal repair crew that helps stop bleeding and heal bruises. If the crew is short-staffed due to liver issues, bruises may become more frequent. Clinically, this increased tendency to bruise can be associated with a decline in clotting factors produced by the liver. So, if you're noticing more bruises than usual, especially with minor bumps, it's worth consulting with a healthcare professional. They can assess your liver function and provide guidance on how to address any potential concerns. Remember, early awareness and action can contribute to maintaining a healthy and resilient body. So go ahead and subscribe our channel now to learn more. Thank you so much for watching my video today, and as always, I wish you great health, wealth, and happiness.